Good morning, everybody, and sorry for the delay. I assure you it was due to a technical difficulty. We were here. We were just struggling to get the live feed up to you, but it seems we've addressed it now, and thank you very much for your patience in this regard. At the beginning of the coronavirus, I pledged the Democratic Alliance's support to both President Ramaphosa and the government to do everything that we could to assist in fighting this virus and its effects on our country as well as the people of South Africa. As a result of that, in the first initial meeting we had with the presidency at Steenhuisen, we committed to putting on the table workable solutions that will assist government to be able to fight the virus. Resulting from that, our first input on that through the channels that were created was our Blue Book. It's also available on our website, which set out some thoughts on a ministry by ministry basis on which we believed we could make some suggestions. It's been very pleasing that some of those suggestions, particularly around some of the economic inputs, have been accepted by government. And so today I want to have an opportunity to release to you, we've already sent it through to the presidency, but our new smart lockdown model. The Democratic Alliance's policy unit, headed by Gwen and Ngwenya, has been working tirelessly over the last fortnight with healthcare specialists, financial experts, policy specialists, our federal executive, as well as our shadow cabinet, to come up with a new approach that will deliver a smart but sustainable and flexible lockdown model to South Africa. We believe this will supplement government's coronavirus response effort, while at the same time protecting the South African economy and the livelihoods of the people of South Africa that depend on that economy. As I said, we've submitted this to the President, but we submit it as a working paper, which means that the document can be easily updated and amended to mirror the changing circumstances as we progress in combating the virus. This is part of our effort to work collaboratively with the President and the government in combating this pandemic. Managing COVID-19 is going to be a marathon and not a sprint. Realistically, we may have to contain the virus right up until a treatment or a vaccine for this is found. This could take between 18 to 24 months. We must hope for a shorter period, but we must plan pragmatically for a much longer one. In addition to this, South Africa was already in a recession prior to the arrival of coronavirus. Under this hard lockdown that we find ourselves in now, we're heading towards an economic depression. It's going to be very hard under an economic depression to fund an adequate healthcare response to the virus over that time period, while also bridging the divide between poor households and small businesses, between sustainability and survivability, and collapse and ruin. Therefore, we need to contain this virus over the coming year in a way that as many as possible of us as South Africans can get back to work. There is mounting global support for a phased approach, moving between different stages of restriction. Of course, it would be absolutely imprudent for a complete easing of all restrictions relating to the current lockdown, as it would in all likelihood lead to a spike in infections. And that is why we have supported President Ramaphosa in extending the lockdown, but we have made 6 key suggestions about how we can really make this extended lockdown work. What we don't want to do is to end up at a stage at the end of the 5-week period where we have limited data and limited information that will inform our decision making going forward. So it was, in the absence of that data and information, the right call to make to extend the lockdown, but we need to start transitioning out of a hard lockdown provision. And so, because it would lead to a massive economic collapse and will increase largely the number of unemployed South Africans, and it will close businesses that in all likelihood would really struggle to reopen at the end of the crisis. A phase strategy gives South Africa the flexibility to adapt to changing circumstances, but it also provides people with an incentive to comply with the regulations. We believe that it is a completely false choice to distinguish between the loss of life on one hand and the loss of livelihoods on the other, given that it is economically active citizens that pay for our food, our hospitals, our ventilators, and our doctors. An economic collapse as a result of a continued hard lockdown will also equate to a loss of life. So what South Africa needs most is a strategy to balance the containment of COVID-19 and the containment of the economic fallout as a result of the lockdown. Addressing this twin threat to South Africans' lives, the spread of the infection on the one hand and the grinding economic recession on the other. We have developed and spent a lot of time and effort on the smart lockdown model for a number of reasons. First of all, the hard lockdown in its current phase is not a feasible approach to contain the coronavirus in South Africa. In our context, it is impossible for citizens living in townships, informal settlements, and other densely populated settlement to self-isolate, to quarantine, to practice the necessary level of hygiene to kill the virus, as well as to acquire the required personal protective equipment to keep the virus at bay. Regardless of whatever may happen when the lockdown ends, South Africa cannot simply go back to a business as usual approach. We're going to need a phased and flexible approach to ease the lockdown, but also making sure that we contain the spread of the coronavirus, save lives, bearing in mind that this virus is not going to disappear at the end of this 5-week period. What the lockdown is meant to do is to ensure that it buys you time to develop strategies and implement measures to contain the virus in a sustainable way going forward. We believe that our smart lockdown model is a sustainable and implementable solution to this particular problem. The truth is, South Africa cannot afford a hard lockdown. The economic repercussions of a hard lockdown, an extended hard lockdown, will be disastrous for the people of South Africa, our economy, and thousands of tax-paying citizens will emerge from this COVID-19 crisis unemployed as a result of that. Furthermore, South Africa does not have the fiscal space necessary to accommodate the assault a hard lockdown will unleash on our economy. Leading economists Jamil Ahmad and Davy Root have already predicted that the South African GDP will contract between 4% and 6% in the second quarter of 2020. We must be urgently planning to address this scenario once the lockdown begins to ease. And we believe that the smart phased approach is the way to go. So people are asking, how does this phased lockdown work? Well, it functions similarly to a load shedding grid or the different stages of water restrictions that South Africans and people in the Western Cape have come to know. These are both strategies that are familiar to South Africans already. It provides for different stages of lockdown relative to the national data, coronavirus data that is coming out for every sector of the South African economy and society. We have released to you as the media and to the public today our complete working paper, and we invite you to read through it as it drills down into greater detail. We believe that this strategy is the right one for South Africa, and we believe that it is the right approach to saving lives as well as livelihoods. It will include moving between different lockdown stages, so different specified stages of economic and social activity in response to what the data is telling us about new daily infections and hospital capacity. It must be accompanied by a massive rollout of testing, tracing, and tracking, what we call the 3 T's. It's only through testing, tracking, and tracing that we're going to break the chain of infection in South Africa. We need accurate, up-to-date, transparent data and documentation from government, and we need to move towards a 24-hour turnaround time on testing results. We also have to massively ramp up the amount of testing that is being done. The global best practice for the South African scenario shows us that we should be testing between 17,000 and 60,000 people per day in order to get us the correct data sets that we will need to give us an ability to be able to make decisions going forward. It is also very important that that data and the modeling, as well as the statistics, are shared as widely as possible with members of the media, with political parties, as well as the general public. This is very, very important. In this game, knowledge is power. The more people have a knowledge of where we are at in combating the virus and what still needs to be done, the more powerful it's going to make the general response for society to be able to deal and win the war against COVID-19 in South Africa. So we believe that government needs to be more transparent on the data as well as the modeling that they are using to inform their decision making. We also need to make sure that we build up our healthcare capacity and need to couple it with a transparent reporting of progress data. So South Africans should be brought up to speed with exactly where we are at in the particular modeling. It also means that we're going to have to involve the private sector in public-private partnerships. Government is not going to be able to do this alone. And so we need to be unleashing companies that can be repurposed to produce personal protective equipment on a mass scale to keep our frontline defenders against COVID-19 safe, but also to ensure that we are unleashing the technological capacity of South Africa to assist with app-based tracing, tracking and testing, and making sure that that data is fed into data sets that are easily understandable and able to inform the decision making. We also need to absolutely move towards a culture of mask wearing in South Africa, in public places, all of the time. A simple cloth mask like this should be standard equipment for every single South African, and whenever they leave their home, South Africans must be compelled to wear these masks to help us stop the spread of virus. It needs to become part of our culture going forward, certainly for the next 18 to 24 months. And so these cloth masks do not detract or divert surgical grade PPE away from our hospitals and medical personnel. People can fashion these masks themselves, but we should have companies that are mass producing them for distribution to citizens. This simple mask is one way in which we can really stop the spread of the virus going forward. We need to then also ensure that we roll out a comprehensive public education campaign focusing on hygiene as well as diagnosis handling, and this includes strict health protocols for public places and workplaces. And we need to assist high-risk groups, particularly elderly in our population, to be able to continue self-isolating where possible. We need to have strict border control to ensure that as we start to beat the virus, we don't have it being brought back into South Africa through porous borders. And then we need a bold economic stimulus package that can get quickly into the economy to help us bridge the divide for our citizens between the COVID world and the post-COVID-19 world. The focus of this, and we reckon it should be around about 300 billion focused on the stimulus package, should be on two key areas. Firstly, poor South Africans who are unable to feed their families and be able to make ends meet. We already have a very large network, a social network in terms of SASSA, which provides us with a facility where we can inject money into to be able to bring relief to those families that are in need at this particular time. The bulk of the recipients of SASSA grants in South Africa are precisely the poor and vulnerable South Africans that we should be assisting at this time with some form of financial relief to be able to buy food, to seek medical care, and to sustain themselves during this period. Then we need to make sure that we have a focus on small business and employed South Africans, and that this focus and the money that's being put aside makes it into their hands as quickly as possible. Most small businesses in South Africa do not have large cushions or reserves to last out a period like this. The sooner we can get finance relief into the hands of those small businesses, the sooner we're going to be able to help them to keep their doors open, to keep their employees on payroll, and to ensure that they are in a condition to be able to start trading again once COVID-19 has passed. The TERS and the UIF are platforms that can be massively expanded to help with this. Unfortunately, the bulk of the queries that we receive are people who are unable to access the UIF platforms, or in small businesses who have made applications but have heard nothing yet in terms of what relief will be granted to them. So it is very, very important that that particular takes place. Our model is available in graphic form, and we have tried to simplify it as much as possible in terms of a color wheel which takes South Africans through the various stages. So stage red in terms of that document, in terms of the wheel, is the hard lockdown where we are currently finding ourselves now. It then moves into an orange phase where there's what we term a soft lockdown. It then moves into a stage 2, which is the yellow phase, which is the soft opening, and then stage green, which will be an open. But if you have a look at the documentation and you look at the wheel, even in stage green, where we refer to an open market, it still has elements of social distancing. It still has elements of restrictions that are going to be required. This is important because we reinforce that South Africa this virus is going to be with us for a long time. And what this phased approach does is allows us to be able to transition between it so that we don't end up keeping South Africa in hard lockdown over an extended period, destroying lives and destroying livelihoods at the same time. The details of each stage are available in the extended working document, and obviously this can be amended as it goes on, and that's why we're calling it a working document. So as circumstances change, we can ensure that it is implemented effectively using up-to-date data, using statistics, and using modeling to determine how we move through these particular phases. By implementing the smart lockdown, South Africa can not only continue to contain the coronavirus outbreak and saving lives, but also ensure the revival of our ailing economy. Furthermore, through the stimulus packages and the economic reforms, we can cushion South Africa against the economic failure of the existing hard lockdown and utilize the proposed public education campaigns to prepare the nation for the necessary lifestyle changes we are going to have to implement and get used to as South Africans as the lockdown eases and is gradually lifted. As I said, cloth masks are going to be with us for a very, very long time to come. We need to also remember that the South African context is a unique one, and that a tailored approach to defeating COVID-19 is essential to protect us not only against the threat of coronavirus to our lives, but the threat of contingency measures to contain the virus on the sustainability of the livelihoods that put food on our table, that pay for our medical services, and ensure we are able to survive. Through our smart lockdown model, which we've released to government today, we believe we can protect both lives as well as livelihoods, ensuring that South Africa defeats the coronavirus and emerges from the outbreak with a capable and competitive economy, which will sustain and create jobs and will ultimately pay for the provision of the healthcare economy and services at the scale required to defeat the coronavirus. We believe this is the only way forward, and we are calling on President Ramaphosa and his team around him to join us in reading through this document and looking at a measured, flexible, and smart approach to the lockdown of coronavirus in South Africa as a matter of urgency. We remain committed to working with President Ramaphosa and his government on the front lines of ideas in terms of defeating the coronavirus. This is a time in South Africa where we need the best of everybody to be around the table and making these key decisions. It's going to require the best of all South Africans to come to the party and ensure that we are standing together to beat the coronavirus. Now is the time for these ideas to be considered, to cast even wider for ideas. Perhaps there's an adaptable model in terms of this that could be used. But we will continue to put these ideas on the table in a constructive, workable fashion so that hopefully we can emerge through this terrible time in our country's history, united, stronger, and more confident about facing the future than ever before. Thank you very much. I will be able to take questions. So I've got a question here from Natasha. Thank you very much, Natasha. You ask about the testing, 17,000 to 60,000 should be tested per day. Do you think that the country has enough resources to do this? Is it feasible? Well, I think it has to be feasible, Natasha, because without the 3 T's, we're going to be sitting at the end of the 5-week period no better or with no more knowledge than we had at the beginning of the period without those testing. We need to find the virus, we need to find out where it is at, and we need to then make sure that we have smart ways to contain the virus and to ensure that we protect the lives of people there. So any money that government is able to channel into the 3 T's, testing, tracing, and tracking, is money well spent. And it should be the primary focus, certainly during this period of hard lockdown. The more testing we get done, the more we will be able to make an informed decision at the end of it. And that decision may be to continue the hard lockdown for a further period. But it may also point to some other solutions that we can have. But we can only make these decisions if we have the data. Simanikwe from The Citizen, thank you very much for your question. There's a number of South Africans and other parts of the world who want to come home. Is it wise to continue repatriating South Africans? I think it is absolutely wise to continue to repatriate South Africans. I think it is unconscionable that we leave South Africans stranded abroad at this particular time. And we know there are a number of people in Thailand and parts of Africa, in the United States and other countries who are desperate to get home. They have dwindling financial resources. They've been essentially stuck in limbo, either from business or holiday trips, are running out of money and are not able to sustain themselves there. Other countries around the world have focused very hard on a repatriation program. But even that repatriation program is going to have to make sure that it has resources to be able to ensure that when people come in from these countries, particularly high-risk countries, that there is a quarantining period and that they are tested and made sure that they are safe before we simply just let them arrive at an airport and drift into South Africa. Remember, the 3 T's are going to be absolutely essential in terms of combating this particular virus. I also have Gwen and Ngwenya here with me. Gwen, I don't know if you want to add anything to any of those particular answers as we wait for more to come through.
I don't. I think those have been answered well.
Okay, great. Okay, Danny Harris asks us, do you think after 5 weeks the virus will be contained, or will it explode and kill off the weak and elderly? Danny, it's a good question, and I think it speaks to the point that we need to accept that even with a 5-week hard lockdown, even with a 10-week hard lockdown, you're never going to kill the virus. What the hard lockdown does is buys you time to be able to get and gather the data, to find out where the virus is, how quickly it's spreading, and to manage your healthcare capacity and make sure you've got the resources in place to deal with the virus going forward. And so it is a buying of the time. The only way we're going to beat the virus is through testing, tracing, and tracking. And of course, doing that and mitigating the management of that while they work towards a vaccine or treatment. Natasha, thanks very much. You ask us a question here. Have the DA engaged President Cyril Ramaphosa on the party's request to relax the lockdown regulations on essential services? Yes, we have. This document, the working paper, has been sent through to the presidency under my letterhead as part of our constructive engagement with government and his request for us to feed in ideas. We will continue to do so. Last week in a statement, you had said the end of the lockdown should be determined by the scientific data and not the president. Do you fear that an extension of the lockdown will further damage our ailing economy? Absolutely. The further extension of the hard lockdown, the red stage in the center, will undoubtedly have an impact on our economy. Just for the existing lockdown period, the South African Reserve Bank has predicted that over 370,000 jobs will be lost, and that there would be probably more if it was extended. So there is a cost to this period, and that's why we've got to use the hard lockdown wisely and to its full effect, and that is to gather data, get the information on the table that will inform how you move forward. Keeping the country in the hard lockdown is going to be very, very difficult and sustainable in the medium to long term, and so you've got to start moving towards a phased approach that allow you to exit strategy to be able to transition. And bear in mind, if you move to the orange or the yellow and there's a spike in infections, you can always move back into the red. But what it does is it gives you the flexibility to be able to manage it without the terrible effects that it's having on job creation and livelihoods. The members of your party hold a different view. Well, that's not true. This idea and this document has been through our governments in both the Western Cape and the City of Cape Town. It's been through the federal executive of our party. It's been through the shadow cabinet. It's been through the specialized subcommittee, which Gwen and others sit on, of the shadow cabinet, that has been focusing specifically on how we manage the lockdown and how we move South Africa forward in the midst of this crisis. And it has been adopted and approved by all of those particular bodies, and those people have all made input into the document. How much have we donated to the Solidarity Fund? We will be making a donation to the fight against COVID-19. We've got a subcommittee that's been set up, headed by Dr. Dion George, the National Chair of Finance, who's working out how and facilitating how that donation and what the quantum of it will be. Ngwenya says that raises the issue around cigarettes and has undermined the lockdown by trying to sneak in the sale of cigarettes. Now it asks 11 sectors to be opened, even pet shops, and again including cigarettes. How much do the tobacco companies contribute to the DA? And is the DA not speaking with a forked tongue, asking to be informed by the president, claiming to support him? I mean, it's springing this document on the government while undermining the lockdown throughout the Western Cape. I don't think that's a fair question. First of all, the cigarettes are not a specifically rejected item like alcohol, and the Western Cape is of the view that there is an interpretation issue around that. But the Premier has not opened up the sale of cigarettes in the Western Cape and is in consultation with the President. This document's not been sprung on government, Ngwenya, and with respect. It is as a result of a request by government and the facility that's been created for us to share information with government. We are certainly not making decisions based on who gives money to who. We're making decisions in the best interests of the entire economy and on all the people of South Africa. And we will continue to make these good ideas. Now is not a time for opposition parties to be sitting on their hands. We've got to join the fight against COVID-19 in South Africa, and we've got to be on the forefront of ideas. The government doesn't hold a monopoly on beating this virus, nor does it have all the answers to all of the questions. We believe it is our job as a constructive opposition to work with government, to put ideas and thoughts on the table, and to move with constructive, positive suggestions. We believe this is a constructive and positive suggestion to the government. We're not saying that this is the only way, but these are our views on what we believe should be informing government's thinking. I think that there's no more patriotic act for any party in this country to be thinking about working towards ideas to get South Africa through this environment. That's why I disagree fundamentally with the fact that Parliament has essentially shut up shop during this crisis. What we should have is the best people in South Africa around the table working how we're going to get through this together. It is very important that we stand together, but that doesn't mean that we can't be putting alternative viewpoints, testing different ideas, and looking at the problem from a variety of different angles, because I think it's through all those ideas coming together that we're going to be able to beat the virus. So no, I don't share your view that it is undermining. I think it is precisely what we should be doing. These are the questions we should be asking during a national crisis like this. And this document is precisely the type of contribution that an opposition party should be putting forward constructively. That's the end of the questions. Gwen, is there anything you would like to add to this particular, as someone who's been intrinsically involved with the document itself in terms of Yanyan's question? Is it informed by any lobbies or the like?
No, in fact, I would say that we went into this process with, with quite agnostically, with not particularly favouring any particular view. We really wanted to hear what the experts had to say across a wide range of fields. This is the best way to approach a task such as this. And it's important to note that even the experts themselves across different fields, whether it's epidemiology, whether it's virologists, whether you're talking to data scientists or public health economists, so those who work at the nexus of health and economics, that even amongst themselves there isn't 100% unanimity as to how exactly we should move forward. So we must accept that this is a time when all we can do, the best we can do, is to gather the best of the available opinion and research and to say, for now, this is what we think is a workable way forward. So very much this is what has come out of those extensive consultations, and I think those experts, we won't name them just because of the current environment, but I think they've been very generous with their time, and we have stressed that this is a working paper. So most definitely we want to add meat to it in the coming days and weeks. We want to bolster it, so any information in that regard that can help us do that will be welcome, and we will have to adjust it as the scenario changes. One thing that I would just sign off with or leave as a takeaway is that it is so very important for us to remember that our ultimate objective is to save lives. Kind of full stop for me. Our main concern is to save lives, that we realize that this twin threat that you highlighted, that lives will be lost due to economic disaster and lives will be lost due to a health disaster. So both things are very much about saving lives, and that also this is not a linear model, that we could ease restrictions a bit until we get to a lighter stage. So let's say we're in stage yellow, which is stage 3 of our model, and then see, as we look at the data, that we actually do need to return to stage 4, which is a hard lockdown. So I think people should not be viewing this as us opposing the hard lockdown. We supported it when it was introduced for the first 21 days. In fact, a hard lockdown or stage 4 is part of the smart lockdown approach. We're just saying you can't only have one stage. You now need to have a strategy that will take us into the medium and to the long term. Yeah. But I think all of those points have been covered, but I just think in summary, that is the things that I would emphasize, and to say that we continue to look for people's input and how these various stages should be constituted.
Yeah. Thanks, Gwen. And I think you're absolutely right there when you talk about us saying that we supported the hard lockdown. It was the right decision to make, and it is what distinguished South Africa's approach to that of the United States and the United Kingdom. The president and his team locked down early and locked down hard, and that was precisely the right thing to do, which is why we got fully behind it. It is also why we support the current lockdown extension, the hard lockdown extension, in order to buy time, but we've got to use that time wisely to gather data and ensure that we get the information that is required to save lives in South Africa, and then to start moving towards a transition where we're focusing on how we can ensure that when we exit this, we don't have people dying from economic disaster as well as the health disaster. So I think these are all very important points. We really encourage you. The document is embedded in the hyperlink here. It'll also be available on our social media platforms, and it went off to the presidency through the channel that was created by him this morning. And we look forward to a constructive response. And I commit our party to working constructively with government, to supporting government's efforts in a united front against winning the war on COVID-19 and ensuring that South Africa emerges at least in a better shape out of it than we could be if we just simply have economic collapse as well as a major loss of life. Thank you very much for your time today. I'll be doing Corona Cast tomorrow with Ellen Windy. So Ngwenya, if you are want to tune in tomorrow, Ellen's going to be with me here in my studio to talk about the Western Cape response, and I'm sure we can get him to traverse their interpretation of some of those regulations that you've taken issue with. So do tune in, and I will make sure this question is put to him as well. Thank you very much for your patience. Thank you very much for bearing with us during our technical difficulties. We're all adapting to this new COVID world, and I'm sure we'll get it right going forward. But thank you very much for your time. Enjoy looking at the document, and I hope it gives food for thought and starts to shift this debate away from the binary way in which it is currently presented, and one in which is flexible, constructive, and able to move South Africa with boldness into the future. Thank you very much.